Geriatric Rehabilitation. Management: pharmacological management, physiotherapy management, psychological management. Pharmacological management: drug therapy is possibly the most common intervention in the medical treatment of elderly people. Drug consumption increases with age, and prediction of expansion in the elderly population suggests that drug therapy will become an ever more important public health issue. Research evidence continue to demonstrate the benefit of continuing drug treatment into old age, and in some cases, the pharmaceutical industry drug is targeting new drugs at problems commonly associated with elderly, example stroke treatment and prevention, Alzheimer's disease. While elderly patients are most likely to be taking different medications, they are also among the most vulnerable to potential problems. These problems include adverse reactions to drugs, interactions between drugs, and difficulties in adhering to prescribed regimens. In addition to prescribed medicine, patients also take non-prescribed medicine, commonly known as over-counter medicine. Commonly taken products include laxatives, painkiller, indigestion remedies, and cold and flu remedies. In the community, pharmacists are asked for information and advice on a range of health and lifestyle matters, including nutrition, smoking cessation, joint problems, foot problems, incontinences, and many other. Particular drug groups are well known to be associated with problems in elderly patients. Diuretic water tablet, non-steroidal anti-inflammatories, example aspirin, ibuprofen, rheumatic and arthritis condition. Hypnotic sleeping tablet, non-prescribed drug brought by the patient can sometimes adversely interact with prescribed medicines. Some drugs can cause or contribute to urinary incontinence. Other may cause constipation, occasionally resulting in overflow fecal incontinence, confusion, sedation, nausea, change in bowel habit, and balance problem are symptoms that can be confused with a new illness rather than an adverse reaction to medications. The reported incidence of adverse drug reaction in the elderly is 20 to 25%. Physiotherapy management: physiotherapists work as advisors and educators as well as practitioners, and intervention may comprise a range of strategies reflecting these varied roles. Manual therapy techniques including soft tissue mobilization to reduce pain and stiffness in joints. Physical exercise can be used to improve strength, range of motion, balance, and coordination. Exercise approaches including home exercise programmed to improve muscle strength and power to retain posture and balance. Training activities can be used to improve the following: postural alignment, body mechanics, and static postural control, dynamic postural control, including musculoskeletal response necessary for control of movement and posture, adaptation of balance skill for varying task and environmental condition, use of sensory monitoring for postural control, safety awareness and compensatory strategies for effective fall prevention. Improve balance control. Small perturbation can be used to activate strategies designed to maintain position. Large perturbations can be used to activate stepping strategies. Patient safety and protection against fall should be maintained during all perturbation training. General techniques: narrowing base of support, displacing the center of mass, minimize the contribution of visual and proprioceptive pathway, narrowing of base of support, feet apart with assistive device, feet apart without assistive device, feet together, semi-tandem stand, heel to toe stand, one leg stand, toe stand, heel stand. Displacing the center of mass, turning in a circle, shifting weight from side to side, stepping over obstacles, turning or leaning while holding a heavy object, crossover walking, sideways walking, moving weighted arms or leg out to the front or side, balancing on large ball or rocker platform, minimizing contribution of visual and proprioceptive pathway. This is simply accomplished by closing the eyes during any of the movements mentioned in the preceding two sections. Proprioceptive inputs can be accomplished by standing posture on highly compliant surface like mattress. Balance prescription into daily life. While standing in line, cooking, combing hair, or doing dishes, move your feet closer together or stand on one leg, alternate leg every 15 to 30 seconds. When crossing a room or other short distance, tandem heel, toe, or sideway walk for 10 to 20 feet instead of normal walking. Close your eyes or stand on one leg while riding a moving bus or train. Carry small items by holding them out at arm's length while you walk. Attempt to rise from chair without use of the arms. Improve safety and reduce fall risk. Prevention of fall in the elderly and for the patients with balance deficiency is an important goal for therapy. Patients' education and lifestyle counseling. For example, the high risk activities likely to result in falls, including turning, sit to stand transfer, reaching and bending over, and stair climbing. Patients should be discouraged from clearly hazardous activities like climbing on step stool, ladder and chairs, or walking on slippery or icy surface. Patients should be encouraged to maintain an active lifestyle, including a program of regular exercise and walking. The patient should be instructed in how to maintain an adequate base of support when turning or sitting down. Assistive devices should be used to improve balance when necessary. Use of ambulatory aids for ambulation in elderly people. Ambulation might require the use of assistive devices in older to be safe and practical. A cane can be used to take some weight off a painful hip and provide additional stability if balance problems are present. Crutches can be used if a patient need to take weight off a lower limb more completely. Forearm crutches may be employed if there are limitations with grip strength. A walker provides stability and allows the person to convey items from place to place with a bag or basket on the walker. Wheelchair allow for distance mobility in the community. To improve stability, use of proper orthosis and footwear. Changes in footwear can sometimes improve stability with movements. Lower heel cause weight bearing to be spread over more of the foot than high heels. High-topped shoes that extend superiorly to the ankle can give additional sensory feedback as to foot position. Orthotic device may help with pes planus. Cardiovascular endurance training according to ACSM. Aerobic activity, many types of exercise fall into this category: walking, hiking, running, dancing, stair climbing. Mode of aerobic exercise: differential effects of various aerobic activities on bone mineral density. Walking alone is not been shown to significant improve bone mineral density. High impact activities such as jogging, jumping, and running, although beneficial for bone formation. High impact exercise plus high intensity resistance training was effective for bone mineral density improvement. Men and women without underlying arthritis may perform high impact activities safely. Intensity of aerobic exercise refer to the amount of oxygen consumed, VO2, while performing activities which will vary from 0.5 kilocalories per minute for light activities, 5 calories per minute for light activities, 7.5 kilocalories per minute for moderate activities, 10 to 12 kilocalories per minute for heavy activities. Difficulties with an intensity prescription based on HR in older adult include presence of arrhythmia, pacemaker that may alter the HR response to exercise. Increasing the intensity of aerobic exercise for older people. Mode of exercise: walking. Way to increase intensity: small weight around wrist, swing arm, add incline hill or stair, carry weight backpack. Cycling: increase pedaling speed, increase resistance to pedals add hill, add backpack. Water activities, use arm and leg in stroke, add resistive equipment for water. Risk of aerobic exercise in older adults, musculoskeletal, falls, fracture, ligament or tendon strain or rupture, muscle soreness, stress incontinence. Cardiovascular, arrhythmia, cardiac failure, hypotension, ischemia. Metabolic, dehydration, electrolyte imbalance, energy imbalance, hyperglycemia, hypoglycemia. Muscle strengthening exercise. Resistance training is a novel activity for most older men and women. Supervision is recommended initially to ensure proper technique, provide confidence, and ensure progression to appropriate level of intensity. Success in getting older adult to progress to higher weight require continuous supervision. Strengthening into daily activities. Guiding principle used. Use smallest muscle mass to accomplish task. Example, rise from chair without using arm to assist. Lift heavy object with one arm instead of two. Stand on one leg. Climb stairs using hands only lightly for balance on rails. Resist gravity. Example, sit down slowly, slowly up and down stairs. Lift slowly rather than swinging object into position. Perform isometric contraction when resting. Push down on floor with toes when sitting. Stand on one leg whenever waiting in line. Press leg together when sitting or lying. Place hands, palms up under desk and pull up while sitting. Perform Kegel exercise. Physiotherapy treatment for osteoporosis. Postural exercise, wall arch, back bending, wall sliding. Postural exercise help to improve posture. Regular exercise like walking. Spinal orthosis when patient is erect and mobile. Support like belt, collar, etc. Weight bearing exercise, strengthening exercise. Physiotherapy treatment for osteoarthritis of knee. Measures to relieve pain and muscle spasm. During the acute phase, during this phase pain can be satisfactorily controlled by TENS, ultrasound and cryotherapy and hydrotherapy. Exercise regimen. Exercise are a most effective therapeutic modality in treating osteoarthritis of knee. Various forms of exercise recommended for ONE. Ergonomic advice. Do not squat. Use a western toilet. Daily walking, cycling, sit on chair or table. Physiotherapy treatment for stroke. The energy cost of walking in patients with hemiplegia can be twice that of the able bodies. It is important to avoid deterioration in exercise tolerance immediately after stroke by getting patients upright as soon as possible with intermittent standing and sitting. Aerobic conditioning can promote decreased body weight, decreased body fat, and improve coronary artery endothelial function, to improve gait and balance, to give fine motor training, to teach the patient transfer activities, to give post-operational training, rehabilitation according to patient's job, business, work, occupational training. Minimize urinary incontinence related to exercise. Void before activity. Drink extra fluid after exercise rather than before or during exercise. Avoid all caffeine and alcohol containing foods for at least 3 hours before exercise. Practice pelvic muscle strengthening exercises, Kegel exercises. Minimize high impact activities. Use intravaginal support or external pad during exercise. Minimize breath holding and use of Valsalva maneuver during exercise. Special consideration in the older women. Pelvic floor muscle exercises are isometric resistance training for the levator ani muscle. Hold a maximal contraction of levator ani for 5 seconds. Rest for 10 seconds. Repeat preceding steps for total of 10 minutes. Complete this 10-minute session for 4 times per day every day. Psychological management. The elderly have to deal with losses of family, job and function. These losses can lead to depression even in people who never had depression earlier in their life. Social work and psychology services are often critical in managing this life changes. Relaxation training, positive benefit of relaxation training, muscle relaxation, lowered blood pressure, reduced ischemic pain, increased energy level, increased sense of control, enhanced awareness of emotional state and memory. Yoga therapy, effect of 12-week yoga therapy intervention on fear of falling and balance in older adult. Laughter yoga versus group exercise program in elderly depressed women, a randomized controlled trial.